For some people, a visit to the dentist is a very traumatic experience. I've seen all the signs and the symptoms, and very often by just looking at the patient's body language, one can see that a visit to the dentist is not a pleasurable experience, in fact, rather a stressful experience. Fortunately, we have many different ways of helping people through those traumatic experiences. Generally, the easiest, simplest, cheapest way is just a form of reassurance and understanding and empathy. Just acknowledge that you understand that this is not a happy experience for them, and just reassure them that you're going to do whatever it takes to make their visit feel comfortable. For people who are anxious or have had so-called traumatic appointments or hard appointments, we do what we call a courtesy or a care call either later in the day or the next day, just to find out how they're doing. Patients really do appreciate that, because they are seen as a person and not just a number. So what we do is I talk to the patient and I assess them in terms of their expectations, what their anxieties are, and we offer them different techniques in how to cope with a stressful visit to the dentist. And depending on the information that I receive from the patient, then we devise a plan that is suited to them in the best manner. And that could either be simply by holding a little stress ball in the chair. Okay, I've seen patients wanting to dig their nails into their hands. Give them a little stress ball. You'll be surprised what that does. Okay. We have a TV on top of the chair, and we play videos. It can be anything from an animal documentary, which patients like, to a sporting event, to music, to comedy, and that tends to take their mind off what's going on in their mouth as well. We've got some nice relaxing music that they can listen to, which also helps. And fortunately also, I've got a very good dental assistant who's very caring, and she helps in terms of relaxing. A little gentle pat on the shoulder. Actually, believe it or not, it says to the patient, "We care for you." So there's all these little techniques. Those are for people what I'd consider mild to moderate anxious patients.